And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Hey guys, welcome to the show. 888-659-3727 is the toll-free number. Thank you so much for hanging out. We're not that late today. I mean, given the normal lateness, I think it's pretty. I think it's pretty good. Didn't even have time to iron a shirt, so I apologize for the slovenly appearance. Well, it's not that bad, I guess. It is what it is.
Yeah, it's okay.
So, guys, welcome.
That's why you wear black. Hides the wrinkles.
That's true. Guys, welcome to the broadcast. Thank you so much for tuning in. This is the Hair Loss Show. And while a lot of you may be new to what we do, we have a great many listeners who have been following this broadcast, following my show, and following me and Joe for just about 2 decades. The reality is 2/3 of you by the age of 35 will suffer with some degree of hair loss, and 40% of hair loss sufferers are actually women. This is a silent epidemic of biblical proportions. It is now estimated $4.5 billion industry. I used to say a $3 billion industry. Excuse me, and that is growing. And, what's interesting is just certain overseas markets, just in hair transplant surgery alone, they are tipping the $1 billion mark, which is fucking wild to me, especially since I've been in this field for so long. Now, I knew that the field would evolve, but I didn't know that it would grow and then devolve. My thought process was that we're going to get in there. We're going to scrub this fucking industry clean. Everyone's going to start doing the right thing. And while that didn't happen, a much larger percentage of guys and gals, physicians in the field, were doing the right thing, did improve the infrastructure of their practices, were offering state-of-the-art hair transplant surgery for quite a long time. I say a good solid 8 or 9 years.
Yeah.
We were able to make that happen. That shit is over, man. It is done. The game has completely changed. The hair loss industry as a whole has completely changed. The snake oils are back, and they're back, and they are bigger and more in your face than ever before. The internet has completely created an environment that has allowed the free-for-all that always was this hair loss industry to proliferate, to grow exponentially, to essentially be out there and do whatever they need to do to get your fucking business and to prey on vulnerable hair loss sufferers. Now, we talk about the hair transplant field all the time. Hair loss field is no different. Hair loss field is always, it's a history of bullshit. Hence the term snake oil. Back in the day, they were actually selling snake oil to cure hair loss. Shit made from snake venom. Think about that. So, sadly, as much as technology has advanced, as much as the world has advanced, the hair loss and hair transplant field has moved backwards. We are back in the dark ages. There is no doubt about it. There are Reddit forums or whatever they're called and Facebook groups and all kinds of shit that are out there. They're just there's a book. Let me see if I can find the title of it. And I even forgot the author, but I heard about it the other day. Let me see if I have it here. But anyway, it describes the entire phenomenon that is now the internet, that essentially there's no more need for real expertise. The majority of the world in every aspect of life and medicine and culture, everyone believes that they're an expert now because everyone can go online and read information that appears to be verifiable, that appears to be legitimate. If it's on Wikipedia, it must be true. But people forgot for a long time that, while there's a lot of accurate information on Wikipedia, and I think those who are trying to make Wikipedia what it is are trying to create an accurate platform, a lot of the shit isn't verified, man. A lot of the information out there online is just not verified. It's just regurgitated bullshit. And sadly, that's even happening in the mainstream medical community. If you go to the Mayo Clinic's website, then you go to somebody's blog, and then you go to some other small website, they regurgitate the same, in some cases, misinformation about surgical hair restoration, about, mainstream diseases. And when I say mainstream diseases, I'm talking about, like viruses and fucking, shit that could really fuck you up.
Mm-hmm.
And I read some of this stuff, like for years, and this is still written in stone. There was a thought that that sunlight actually suppressed the immune system in a way that activated viruses in your system. The reality is there is some level of suppression. But there just came, there was just a major study about 2 years ago from Georgetown University that stated clearly that UV radiation actually increases the speed that T cells react to infections. What does that mean? It means it boosts your immune system when used correctly and they're overexposed. And the suppression, which people, it's not even written in stone in like WebMD, is actually there to help protect people who have autoimmune diseases, where your immune system actually is hypersensitive and attacks certain things in your body, like, people who are dealing with multiple sclerosis and skin issues like psoriasis, vitiligo, alopecia areata. It's a balancing act, and that's why people have always thrived in the sun. So I guess my point is that sadly now we are just in a world where we're constantly being fed and refed and refed, sometimes decent information, but in most times it's hearsay, misinformation, and it's information that's looked at as expert and expertise or expert information coming from people who are truly knowledgeable. And all you have to do is go online, go on YouTube, and you can see it everywhere. I saw a guy the other day, actually last night, totally different industry. It's in the fitness world. Guy's funny as shit. I understand why he gets so much attention. He has 97,000 followers. And he actually said, I kid you not, that HIV is not a real virus. And he has thousands of followers. Now, a lot of what he talks about is pretty legit. So he brings some interesting information to the table that makes sense about dieting and shit like that.
And that's what makes him more dangerous.
Yeah.
To say stuff like that, because there's legitimacy to some of the other things he says. It adds legitimacy to the comment that HIV is not a real virus.
But you know what?
Assuming he meant like not that it's misclassified, but that it's just not a big deal to worry about.
Well, it was more like it's not a big deal to worry about. And in a sense now, I mean, we are living in a world now where it is a it's a controlled, manageable disease, and they're actually coming very close, believe it or not, to a full-blown vaccine cure.
Right.
Which
I
is
saw that.
which is pretty exciting. It's amazing how, when science puts their minds to it, and there is a true incentive, not just an incentive to sell drugs, but to eradicate a disease like this, they're able to do it. But yeah, I mean, it was as though, like, everybody's got something, so, can't go out there and worry about it. And, listen, I didn't subscribe to his channel, but I actually bookmarked it because I found him very entertaining. Guy made me laugh. I liked watching the chat. It was something interesting to me. But it was proof positive that there is expertise in this world is lost. And I have to find the name of that book when we start to talk about stuff. But speaking about expertise, and by the way, if anyone doesn't know who the fuck the guy on my left is, that's Joe Tillman. If you don't know who he is, you've been living under a rock. You have not done your due diligence. Please don't get a hair transplant or buy anything for your hair loss if you haven't heard of this guy. But he is the original hair transplant mentor. He is the guy who has, really was the first to fully document his process and his procedure. There were some other guys before who did some stuff, but never as in depth as what Joe did on popular public message forums back in the day. And he's been in the trenches ever since. You need to know anything, and Joe wants to explain where the bodies are buried. He doesn't think that people understand what that means. But we know where all the bodies are buried, and Joe may have helped to bury some. I'm just kidding. Joe
got a big shovel.
Has a map. Let's put it that way. He has.
Yeah, I know where everything is.
Yeah, he has the treasure map. Everyone is talking about. We're going to be talking about all these hair loss hacks that people are talking about, and I mean that as hacking something as opposed to, surgical hacks, which are many. But everyone, again, is the latest, greatest money grab is PRP for hair loss.
Right.
The biggest money grab currently in the industry, being performed by everybody who is involved in some form of cosmetic surgery, whether they are just doing Botox and fillers, whether they have a med spa, a fucking massage parlor, the back of your fucking GP's office. And it's important that all of you guys know that the vast majority of PRP for hair loss will not work. Period. Won't help you. You're being ripped off, and maybe unwittingly. It is being sold as a one type of PRP fits all scenario. And it's also being sold on a premise that has been proven to some degree scientifically. And there have been some studies to show that there is evidence, and there's a lot of anecdotal evidence that the right PRP for the right candidate does work. I've seen it with my own eyes. But most of what you guys are getting out there, it's not even platelet-rich plasma. It's just your own spun blood, your own plasma being re-injected into your fucking scalp. It is not energized, meaning that the platelets have not been properly enhanced or multiplied. You're wasting between $800 and some guys are charging $5,000 a shot. I'll let Joe get into this a little bit.
Well, the thing about PRP, I first realized how crazy this PRP hair loss treatment was when I was at a party about a year ago, and one of the people I met at this party that kind of a new guy to the group, he's a dentist, and I overheard him talking about adding PRP hair loss treatments to his regimen. He's like, yeah, man, it's like, and I played dumb. I was like, really? Tell me about it. What's going on? Well, they take your blood and, and they stick it into a centrifuge and they re-inject the plasma back in your scalp, and it helps with hair loss. Like, can you explain how? Well, I don't know all the details of it, but there's a lot of potential with it. I was like, awesome. So, I mean, this is like a great business opportunity, right? He goes, man, I can charge $2,500 a pop all day long.
All day long.
And you're a dentist. He goes, yeah, that's what's crazy about it. I'm like, it certainly is. Good for you. I was going to argue, but it's like, what am I going to do? Like, stick my finger in the hole of the dam and hold back everything? It wouldn't have made any difference.
Well, there's a billboard, electronic billboard on Westwood Boulevard rather. Still getting used to the new digs, and it promotes $4 graft, NeoGraft, and PRP, proven to stop hair loss and regrow hair. That's it. That's how it's being promoted.
With no asterisk next to it.
No asterisk, nothing.
No asterisk.
No. It's proven to regrow hair. And I think they're charging $700 a session. And I can guarantee you that they are fucking packed. Now, I do think about it. When I get aggravated with this field, when I get aggravated with some of the physicians in this field, when I get aggravated with the politics in this field, sometimes I'm like, fuck, man. I'm the founder of the American Hair Loss Association. I didn't look up the news today, but I looked it up last week. I think I told you to as well. Well, we were in Fast Company, BuzzFeed.
Yeah.
I mean, every week we are referenced or quoted in the mainstream. All I have to do is open up a really nice PRP shop. I could rent the place. There's some empty space. It's filling up fast at the Century City Mall. Have a huge American Hair Loss Association seal right in the fucking window. Charge a really reasonable price, and they will be lined up. Don't make any guarantees. I would actually try to, get the right people to do it correctly. Maybe bring some other guy, some guys in, get some info from Joe Greco and some other guys. But that's it, man. That's I don't have to do a fucking thing. That's retirement plus.
I'm talking a series of kiosks through malls throughout the great Midwest.
Like teeth whitening. Yeah. Trucks.
Yeah.
We will do PRP vans.
Huh.
That's it.
Like the hair transplant van.
Like the hair transplant van. That's it. PRP fucking vans. That is how simple it is. That is why it's such a big fucking money grab. And that's what really bothers me. I honestly believe that physicians who utilize PRP in their practice, who are actually performing hair transplant surgery, maybe they can include the costs of the PRP, of the system in the transplant, but to charge an extra $2,500 on top of the transplant or $3,000 on top of the transplant, like, do you want PRP or not? Well, if you do, we have option A. Or we have option B. It's hair transplants without PRP. If you think it works to help fucking patients, then give it to them. Give it to me at your cost. It takes 5 fucking minutes. I mean, it takes a little more to prepare everything.
I'm going to disagree on that, and here's why.
Damn it.
Hair transplants before PRP, before hypothermosol, before ATP, before all this stuff, grew just fine. Maybe took a little longer. Maybe the healing wasn't quite as fast, but they grew just fine if it was done right. And the way I look at these, PRP and these holding solutions, I look at them as potentially in the I was going to say right clinic, but in the wrong clinic, as a shortcut, because these are methods that are proven in clinical observations to increase the survival rate of grafts. Now, things like hypothermosol and holding solutions and things like that, those are included. But with PRP, you're looking for, in a lot of cases, you're looking for some sort of maintenance that's non-medical. In other words, no finasteride. In some cases, PRP is not going to do much of anything except it might help with faster healing. So I think that I don't think it's, I don't like the idea of it being included just for the sake of including it. I think an option is a viable, having it as an option is viable. I think that
I have no idea what you're talking about.
That's okay. But I think that no, seriously, I think that you know, for some patients it does make sense to use it. Some it doesn't. So to include it across the board, I think it's
well, that makes sense to me. What you just said makes sense to me. That totally. Now I get your point. But I guess my point is, don't let the patient make the choice based on whether or not he wants to spend the money on it. If you think, and you agree with you know, if you make an assessment that you think this will help this particular patient, put it into the cost of the surgery. Maybe just charge a little extra for the kit. That's it.
Yeah.
You know, the bottom line is the end result. I want to play something from, and Joe, you won't be able to hear this because it's going to be on your channel. And eventually I'll have that fixed, but just getting Andrew out here to begin with was such a pain in the ass. So I sent, just to let you know, it was a discussion that I had with Paul Rose, where he was actually able to present some real data as far as the PRP kits that are available today. And
they tested what, 7 different systems?
I think it was 9 or 11 or something like that. Now, again, a lot of people will say, okay, well, it was one guy, one study, you know, one group, 3 doctors, one study. But it was across the board in several patients. And, you know, the reality is no one's done it before.
I was going to say it's more than anyone else has done. So.
And he was willing to come out and say, you know what, this shit's not working. There's a reason why Carlos Puig, for instance, wrote something that may not have been positive about PRP because in his hands, things weren't great. And that could be because he was using the wrong system. Or he didn't understand exactly what had to be, how the system, how the platelets had to be manipulated. So let's see if we can get this playing. Hold on. You guys may hear a little opening.
Spencer Kobren's The Bald Truth.
Now, I would love to eventually be able to name names and let people know, okay, these are the systems that seem to be working, and these are the systems that seem to not get such great results. Do you think there's ever going to be a time when we're going to have that data that at least I can go out and say, hey, look, this study was done, and get that information out to the public so they could ask better informed questions?
Yes, I think you will be able to get that data. I'm actually going to try to publish that small study that I mentioned that would give people at least an idea of some of the commercial kits that are out there now, and at least in our hands, what we observe. Now, I think anyone who looked at that study who has a scientific approach could fault us and say, well, you know, how was it measured, and would it measure differently in a different culture counter or a different collecting device? I think there are legitimate issues that someone could raise, but for the kind of study that we did, I think it's really profound that we were able to show such a big difference between systems and how much they concentrated platelets.
Well, listen, I've been aware of this. You know, you were the guy. I'm glad you guys decided to conduct a real study. But, you know, our friend Joe down in your area has been telling me this for a long time. He's saying these guys have no clue what they're injecting into people's scalps. And there really are, you know, not all PRP is created equal. I know I'm repeating myself. The system really makes a lot of the difference. And also, I mean, stuff that's going to help to activate the PRP as well, whether you're using thrombin or I don't know how you guys activate the PRP.
So we use so for when I do my hair transplantation patients, I actually don't use an activated system,
right,
because I feel that the trauma that we cause by making the injections and the incision sites that we've made should activate the PRP.
Right.
But other people do use activated PRP, certainly. You're absolutely correct.
Yeah.
And something that's just come up is I've had patients ask me now about CRP, cytokine-rich plasma. And to my knowledge, I don't believe there are many studies out there that show a significant response from CRP. I don't know how well done those studies are, but I know that that's coming into the forefront, that people are looking for now CRP. And the fact is that in PRP, you're going to have a fair amount of cytokines as well. How much you need, hard to tell. You know, we're back to trying to have a scientific approach to this. And unfortunately, I feel that people are putting monetary gain ahead of good science.
Okay, well, that was the wrong clip, but it was close enough. And it definitely did state, and Joe, you didn't hear that, it definitely did state that he found issue with what's happening in the field and that all PRP is not created equal. And these guys are now selling CRP, and people are just believing whatever is on their fucking website. And that is the problem. Someone in the chat room asked about someone dyeing their hair. I hope they're not talking about me because it's just the lights. My hair is actually fully salt and pepper. You there, Joe?
Yeah, sorry, I was just reading what's going on in the chat. Can you hear me okay? I just my settings mistakenly. I could hear actually through the I turned up my earbuds.
Yeah.
So I could hear what Dr. Rose was saying.
Okay.
But
you know what? Here's the actual study. You guys want to hear this? I think you should hear this.
Spencer Kobren's The Bald Truth.
One of the things I'd like to discuss with you, Spencer, is the use of platelet-rich plasma.
Okay.
As you probably know, many people are advertising the use of platelet-rich plasma. We see it in everything from orthopedics to cosmetic surgery.
I don't mean to cut you off or laugh, but when you say everybody, I mean it is like an epidemic here in Los Angeles. There are. Honestly, I'm not even joking. There are vans parked on the side of the street promoting PRP for hair loss. Yeah.
I can believe it. It's covering every part of your body from your joints to your genitalia.
Yeah.
It's quite peculiar.
Oh, yeah. There's a guy here in L.A., he calls it the P shot, and making all kinds of claims. And believe me, there are guys who are willing to be injected down there if they think they can get, just a half an inch.
Absolutely.
Yeah.
So the point I'd like to raise is that while people use the same acronym, PRP, and we talk about platelet-rich plasma, the platelet-rich plasma from one institution to another institution or from one system, as there are many PRP systems, can be quite different. And I actually did a small study myself where we tested about 6 or 7 different systems. And what we found was that some of the platelet-rich plasma systems actually did not even concentrate the platelets to any significant degree. So people are injecting PRP, and the patient has no idea what they're getting, nor does the clinician even bother to know what the patient's getting in terms of concentration of platelets. And whether there are red blood cells, whether there are white blood cells, there are so many different permutations for the use of PRP that unless we start talking about the same things, we're not going to really be able to compare results. So my point is that we use a system that's been very reliable. As I mentioned, I tried 6 or 7 of them. And the system that we use seems to concentrate platelets anywhere from 6 to 12 times the normal concentration. And we test every patient before we draw their blood. We know what their platelet concentration is. And then we test the platelets once we have obtained them. So the next day, if the patient wanted to, we could tell them what their platelet concentration actually was. And I think that's important. And we can tell them how many red blood cells. We can tell them whether there were white blood cells. That's a little different study, but we can do that.
Well, I mean, it's beyond just important. The one thing that I've always been saying, and I do believe in PRP therapy or treatment for hair loss, but not all PRP is created equal. And frankly, most of what people are offering, and now you have essentially been able to demonstrate this with this study, is complete bullshit. They're not helping anybody. They are just re-injecting, a person's own blood back into their scalp. So they're going through.
So anyway, that's the deal. And again, this is just one really well-respected physician's work. The fact that he took the time to study the different commercial systems out there, and most of the systems that are being purchased by, I'm not just saying, I think the hair guys are kind of getting closer, but most of the systems that are being purchased by dentists, like Joe said, and by
it's just amazing to even have to say that.
Yeah, and by plastic surgeons,
purchased by dentists
and plastic surgeons, and by I'm talking about board certified plastic surgeons and facial plastic and reconstructive surgeons and cosmetic surgeons and med spas. They are going, even if they're paying a decent amount of money for the kit, they're going based on whatever the salesman is telling them, whatever their colleagues may be using, whatever they may have seen at a cosmetic surgery conference, Turkish bazaar. What are they called when you go through and you're looking at the vendors area?
Yeah,
vendor
area, yeah.
That's all, man. These guys, if you would ask them exactly what's being injected into my scalp, and try to bring a list, like essentially just take that that video, transcribe it, and write down what Dr. Rose was saying as far as concentration of platelets, what type of platelets are being injected. I actually have a segment that I did with Joe Greco that he goes into even more, the greater depth about this. And he has stated, pretty clearly that but Dr. Rose did a study, that most of what's being sold out there will not help anybody for anything. And that is really sad as far as, what it says, what it speaks to as far as the integrity of this field and the integrity of, any cosmetic surgeon or dentist or dermatologist who wants to offer it in their fucking practice. They don't give a fuck. It's a money grab.
And that's the thing. It all comes, all this comes back down to the basics when you're doing your research for hair transplant surgery, for rhinoplasty, cosmetic dentistry, whatever. You gotta see consistency in the results, if results can even be shared. And it could be argued, well, how do you know that they're actual PRP patients? That's true, but there comes a point when after you do enough research, you just have to trust your gut that at least they're being honest about it being their own cases. And that's a whole different discussion that I'm actually going to be talking about in another video. But you got to be able to say, yeah, I saw results based on how they apply their PRP before you even decide to consider pulling the trigger.
And also, if a physician
and let them explain to you that it works, you got to see some sort of evidence.
I promise you, though, if we create a list, and maybe I'll do that. It's a good idea. It's a good idea. I'm going to do that. Create a list that people could download or copy of questions to ask their PRP practitioner. And if they can't answer every question, you walk.
But will you have the answers that they should be providing?
Of course. It's no fun just giving them the questions.
But no, but here's the thing. It's like, I asked this because, we both work with the same doctors, but, or I work with the same doctors you work with, but a lot of them have different protocols.
It's not necessarily about the protocol. It's about understanding what the protocol is. It's about being able to explain it in detail, exactly what they are doing to this person.
Well, for instance, in the States, most of the well-known clinics are adding A-cell
right,
into their PRP mixture before they inject it and add thrombin and everything else. In some countries, it's not even legal to do that, so they don't have access to A-cell or any sort of extracellular matrix to mix in with it, yet they're still getting good results.
But that's not a question. It's not a question. What I'm saying is, and I get your point, and it's a good point. It's not a question of what's right or wrong. It's a question of the physician or the practitioner actually being able to answer some of the most basic questions about what is going on.
Yeah. Okay.
And I can tell you 9 out of 10 times they cannot. They have no idea. They don't know the difference between an open and closed system. They have no idea if their system is FDA approved or cleared, rather.
Yeah. Yeah. Those are good questions.
The simplest thing.
If you go to a kiosk and ask these questions, they'll look at you like you're speaking Greek.
Absolutely. You know? Well, I've asked these questions. I've asked these questions to, this is actually not too long ago. I was at a place called, I was at the Century City Mall, a place called Rock Sugar. Ran into a plastic surgeon that I know. He's doing hair and he's also doing PRP for many things. And I had a couple of drinks in him. So I figured, you know what, this is a good opportunity. And I sat there and I grilled him in a nice way. Guy had no clue what I was talking about. This is a learned man. This is a guy that spent, he did a 7-year surgical residency for to become a plastic surgeon. If I'm saying that correctly, I think I am.
No idea. That's awesome.
You know? He just wanted another martini.
It's anyway, I just came here to drink. You're grilling me about PRP.
Yeah. All he wanted to do was fucking have a drink. He actually noticed me, came up to me, and I'm grilling the guy about PRP. I mean, it was fun. You know, we had a good time. And I have nothing against this guy. And I actually did tell him, you know, what he may need to do. He's a good guy.
What's the lesson here? If you see Spencer Kobren out while you're drinking, avoid like the plague.
If you're in this industry, just walk past me. Do me a favor. First of all, you're going to be doing me a favor. All right, guys. So that is the truth about PRP.
The truth about PRP for your hair loss. There you go. God. And I'm going to try to index. Okay, so how far along are we? We are at 5:42. So I'm going to try to index part of this or most of this broadcast because we've been getting requests to index the show. And on Friday's show, I said 3 hours of content. I'm not going to go back through it. John H., I think it was.
Told you to go fuck himself. Go fuck yourself.
I told him to go fuck yourself, and he came back and said, "I'll do it myself." No, I didn't actually. Someone asked me, and I said, "I just way too much content to go through." And John H., I think is his name, he came through, and he indexed our last show for us.
Really?
Yes. So big shout out. Wait, was it Justin H., not John H.? Justin H. Indexed our show for us on Friday the 4th. Was it 4th?
We need more grassroots help.
Justin H.
Grassroots help like that. We need guys to get together and just do shit for the show. Because I have to say that it's just no exaggeration. You know this. Thousands of hours of content that has not been put up on iTunes, that has not been put up on The Bald Truth, that has not been, I basically just, we do our show, we record it live, it's up on your stream.
Mm-hmm.
I haven't even been putting the recordings on the GFQ network because the protocol was always I'd have to go in there, make the edits. They would have to go in, put the opening in. We just put everything up raw on your page, which is great. People get to see it. But we could actually reach thousands of more people if I was able to get that shit done. But the problem that I have is can't trust anybody with this shit. You can't just say, hey, take this and edit it. They don't know where to edit.
Exactly.
It doesn't work. And you know how you can see that? Go to any fucking hair transplant, most surgeons, except for Dr. Cole, of course, most hair transplant surgeons' blogs or their Instagrams, and you can see the people they hire. It is so sad what I see on their fucking feeds. It's like they're not even in the fucking industry.
Because they're not.
Like,
that's
you know. Oh, that's right. That's why you're doing some stuff for this organization.
Yes. Yes. That's why I'm doing some things for an organization. So I'm doing video editing for some doctors because they don't have people that know how to do it themselves. And I don't mean video editing. I mean video editing the right way. So.
Exactly. But we do have this meeting in Manchester. And guys, I'll take your calls in a second. We do have this meeting in Manchester coming up in about a month. I am looking forward to it, even though it's a tremendous amount of work. I don't think the doctors that are going there understand what it's going to take for me to bring a radio show to the fucking UK, and the cost involved and the amount of work involved, and having to have, like, everything's got to be fucking spot on. I'm trying to deal with the people over at the hotel. It's like, okay, they're giving me measurements of tables that just don't make sense, and I have to go from one person to the next. And I mean, it's insane. But we're going to make this happen, and I'm excited
the
about
measurements on that. The measurements you're telling me they gave you on one of the tables sounded more like a windowsill.
Dude, I'm just like, that's impossible. And then this very nice woman said, well, I've been trying to get it for you for a while, and I've here's the number, contact them yourself. I'm just like, look, what we're going to do is going to make history. Period. I'm excited about it. So you know what? I don't mind contacting them myself. I don't mind doing all the work. But once this is done, like I said, I have thousands of hours of content. We're going to be flooding YouTube and social media. And I have somebody who I think I might be able to trust to get some of this stuff done. So I'm looking forward to being able to truly educate people in even a much bigger way than we have in this new world of, and it's relatively new for this industry, of social media, and kind of seeing what has been happening on YouTube. I spent some time yesterday watching, and I'm just like, holy shit. I'm so glad that I'm 54. I'm going to be 54 years old, and I figured this all out already. I really am. Guys on there saying that HIV is irrelevant. Not going to harm you. Anyway.
Dangerous stuff.
97,000 subscribers. Millennials going nuts.
Hey, we can go fuck anything now.
Sad. But, you know what? Kind of learning from the guy. Anyway, 888-659-3727. This is the Hair Loss Show. Let's take some calls. Hey, you're on the air. Who's this, and where are you calling from? Hey,
Hi,
man.
my name is Anup. Hello?
Yes.
Hi, my name is Anup. I'm calling from Boston.
What is your first name?
Anup.
Anup. Anup from Boston. Yes. What's happening, man?
Yes.
What can we do for you?
First of all, Spencer, I need to thank you for all the service you have done. I think if it wasn't for you to put the information out there when I was 21, I would have made like a lot of bad decisions. So I need to thank you for that.
Well, I appreciate you thanking me for that, and I appreciate the fact that you were able to find us. How old are you now?
I'm 31.
Holy shit, I saved your life, man.
I know. Yeah, it's been a long road.
Well, let's hear your story, and then whatever questions you have.
Sure. I mean, it's probably going to take a little while, though. I'll try to
give us the Reader's Digest version or the abridged version. You guys are too young to know what the Reader's Digest version is. Yeah, just kind of give us the abridged version, and then we'll answer some questions for you.
Yeah, sure, definitely. So like 10 years ago, I grew up in India. So I think I was around age of 20, where I just noticed a small bald patch right at the parting. So I just freaked out, and then I just didn't know what to do. And I just the first thing I did is went to Google, and then just Google saying that, how can I, stop hair loss? Or I thought that I was going to go bald the next day.
Right.
So that was my first thing that came to my mind. And I did some research, and then I just found out that there's a possibility that, I thought my hair, whatever you lost, it's basically gone. So then I found out about hair transplantation, and then I just like got obsessed with it, and I thought like, I could just like go get a hair transplantation done, like with any doctor. And then, but the thing is, like at that point of time in India, like there were not many surgeons, like nobody did hair transplantation. And when I did my research on the internet, it was only United States. So I was just 21, like I was basically in school. So I literally like made plans to come to United States so that I could get a hair transplantation. I was that desperate.
I hear you.
A lot of people are.
Yeah, it's just like, I mean, I don't know if I didn't, I mean, let's say if like I didn't lose hair at 21 and it happened like much later in life, I'm pretty sure my life would have been like, so different. And
well, mine would be completely. I would not be behind this mic right now. I'll tell you that. I probably would have, if I started at 31 or 35. I would have been set in some other career.
Yep,
and
I understand.
I might not have been as obsessed.
Right. And so then since then, so I've been like researching, and then so when in so there was this doctor on TV who was actually talking about. This was in India again, so he was like talking about just like how he performed the surgery. So I felt like he's probably like one of the. He seemed very legitimate, so I just went and saw him at his clinic, and so he prescribed me finasteride. In India, it's called. In India, we don't have Propecia, so I went to a medical store and then asked him like if we could get Propecia. So they said that. No, like we don't sell that in India, so you can only get finasteride, generic version of it.
Right.
So he prescribed me that, and I didn't know about the side effects back then, or like even if they existed. So like, I mean, there was like no talk about the side effects, not as much as it's happening today.
It's a phenomenon that really broke in about 2006, and 2005, 2006. That's when it kind of really started to break, and then. By 2012, it was crazy. It was all over the place. Yeah.
Right. Because 2009, like I didn't really hear much about the side effects, and then, but either way, like I started taking anyway because, like the doctor said that it's just safe to take it. There's nothing. Just take it every day. Just don't miss a dose. That's what he said, and then. Just like don't think that you're actually taking a medication. It's just like think that it's just like a vitamin for your hair. And I trusted him because he seemed to be like like he was on TV, so I thought that he's a reputable doctor. And I mean, this might be a positive thing for some of the people who are taking Propecia or finasteride, but I didn't experience any side effects. And in terms of my sex drive or like whatever that's been going on, like whoever is talking about it, but for me personally, I didn't experience any side effects, and and I was able to retain most of my hair. Like I didn't have any, none of my hair receded or, like I mean, I didn't regrow any of my like lost hair, but it stayed what it was. At least for like it maybe thinned a little bit, but if you look in a picture, like if I would know that where it thinned, but if like somebody else. If there's another person who looked at me, he wouldn't think that I was balding, actually. So
you're saying for the last decade, you've been able to essentially maintain what you started with.
Yep. I mean, most
That's
of
amazing.
it. Like,
I love hearing these stories because, believe it or not, guys, if you're just tuning in, these stories are not atypical. That's the thing. I know that Dr. Cole. I noticed that he wrote in the chat room. I'm in Joe's chat. That he doesn't necessarily agree with my particular assessment of how effective Propecia is, but I think based on at least the experience from the guys that come through our program and contact us or have learned about finasteride through the Bald Truth, whether it's through the book, 20 years ago, or through the radio show, or now through the on-air the online broadcast. The guys that didn't worry about the side effects, there's a good percentage of guys that had really positive long-term results. Maybe not as great as yours, but they've definitely, for the most part, slowed down the progression of their hair loss significantly. And I think that's a powerful, story. And what you're saying is really, really powerful because people don't believe that happens. They just kind of think that, oh, well, Propecia works maybe as well as minoxidil. And there's really nothing out there. We have to try these gray market treatments or whatever some doctor's selling us.
What kills me is the idea that finasteride stops working after X number of years, usually 5. That's one of the ones that gets me the most. It's like,
how is that possible? It's like a
where does it come
switch.
from?
What do you think? The drug was built with planned obsolescence?
Like iPhones?
Yeah.
It's one of the most bizarre.
Or marriage?
It's one of the most bizarre ideas out there on the interwebs about hair loss medication that finasteride stops it. The accurate quote is, it loses its effectiveness after 5 years. Let me tell you why I think people say this. For a significant portion of people that are experiencing positive results from finasteride, it doesn't mean that all of the hairs are responding positively. In many cases, finasteride simply slows the process to the point where it takes 5 years before you even notice that you've lost more hair. It's a gradual cumulative effect where you're losing your hair, just not as fast as you were. And it's such a slow rate that it takes up to 5 years or longer to where you even notice it. So that's what people are talking about. They think that it suddenly stopped working when it never completely stopped their loss to begin with. So that's my rant.
Well, there you go. So listen, man, go on with your story. I just wanted to kind of put a pin in that for a second. No, put a pin in it. What's the term I'm looking for? Just kind of highlight that it's so important. We don't hear enough positive stories. A lot of people do call the bald truth and talk about their positive stories, but you just don't see them online enough. And that's what's scary. I wish more people would come out. But here's the problem. When people come out and talk about it online, they are fucking attacked. Like there's some sort of Propecia shills. So I guess maybe this is the safest place. So go ahead.
Yeah, so like I said, I mean, being on finasteride was definitely a good step. And so in between, I was just like researching about hair transplantation. I was obsessed with hair transplantation, but I was also scared whether it's the right step because I have to go with a FUT or an FUE. And so back in 2014, so I felt like I'm still not able to. I tried everything to get over. Like I thought, like my hair shouldn't be that big of a deal. Like everybody goes through it. But I was also like 26. Every time my hair was looking fine, like when it was like dry. But if I was like sweating at the gym, I could just like when I was out in the sun, I could just see there's a little like the scalp was getting visible. Like it started getting visible. So I thought like, maybe this is a time for me. So back in 2014, I went and saw Dr. Feller. He's in Great Neck, New York.
Sure.
Yeah. And because I've seen this, because like reading your, like I follow IAHRS and American Hair Loss Association. So he was listed as one of the doctors, like good doctors in the field. So
now, he was never a fan of Propecia.
Yeah, he's still not. Like I recently saw his website. He posted. I told him that I was taking finasteride. He didn't say anything about it. Like it's your personal decision, but he didn't really. He said that like talk to your PCP, but he didn't really ask me to like. He didn't give me any negative information or like positive information about the drug. That's what I can say.
Yeah. Well, the way he described it to me is like he told me, and this was his exact words, my job is not to treat hair loss. My job is to move hair from one place to the other. And I thought that was fascinating. It was one of the turning points in my it was just one of the turning points for me, and I learned a lot. You learn a lot about people's personalities and their ways of doing things. and bedside manner. This has nothing to do with his surgical skills. I mean, this guy, in his day, this guy was one of the best of the best for a while. He really was killing it. There's no doubt. I mean, this guy, you know, I remember when he kind of took the lead of Victor and Jerry and was like, this is the way things need to be done. Right, Joe?
Yes.
Yeah.
Yes. He was very excited about the use of microscopes and flat blades and all the good stuff that makes for a great result.
So he embraced that shit pretty early on. So I admire him for that. But he was not a fan of finasteride. I always kind of felt that, you know, maybe with that, if you don't really take the time to explain the positives of this, you're not giving the patient the best possible chance of, you know, a better recovery from hair loss. Let's put it that way. But that's just my opinion.
I agree.
Yeah.
Yeah. So I went and talked to him, and then he didn't really like. He said that, like when he looked at me, he said that, dude, like you don't need a surgery. I mean, your hair is fine. Like, why are you getting the surgery?
That's great.
I told him like once he like took a closer look, then he understood that like I did have a thinning. And he said, like, yeah, whenever you're comfortable, like he explained me, he showed me a patient in the operating room that he was performing a procedure on. And I was pretty impressed. I felt like he was very legit about like his work. And but for some reason, I just thought that, you know, come back and get a surgery. But I never went back. Like, so it's been like almost 4 years. So finally I got a surgery again. Like last year, in 2019, because I thought like I turned 30, and I thought if I'm not doing it right now, there's no point. Maybe like 5 years down the line, like I might not even care. But I felt like 30 was the right age for me to go ahead and get the surgery done.
Okay. So what happened?
So I went back to the same clinic, but he wasn't performing. Like Dr. Feller wasn't performing surgery, so he partnered with Blake Bloxon.
Yes,
that's the name of the doctor. And so I spoke with him, and I got a good vibe from him. And then since I spoke with Dr. Feller, and then he's associated with Dr. Feller, so I felt like I'm in Boston.
Did you get a chance to see Dr. Feller again?
No, I didn't see him again. Because the next time when I went. The next time when I went there, he wasn't around. I think it was only Dr. Blake Bloxon who was there. And so finally I ended up getting the surgery, like after all the wait for like 10 years. And so like it's been almost 1 year. I had like I think that was like the best decision I've taken. I had an amazing result.
Wow, that's great to hear.
Yeah, I had an amazing result. I got an FUT done. Just I forgot to mention that. So that
they're proponents of FUT.
Yeah.
FUT. Yes. I got an FUT done.
Yeah.
And the surgery went great. I mean, they were very professional. I mean, it lasted. I got around 2,000 grafts. So it wasn't like a big procedure, but they said that like. For me, I would need around 2,500, but for some reason, I felt like maybe for some reason I told them that I'm fine with 2,000 grafts. Like, I just want to see how it looks, and then maybe if I want more, like I can always go back. But 2,000 grafts was good enough. Like the cosmetic transformation was amazing. Like I didn't believe that. Like, you know, even after researching for 10 years, I could get a result like that because my head looked like as if like I had a full head of hair.
Dude,
even in the sun.
Let me tell you this. First of all, like, you're a good candidate, and I would say that Dr. Bloxham learned from someone who really, you know, knew his stuff. Now, if you go to the IHS now, you'll see, you know, Dr. Feller is no longer performing surgery, so he cannot be a part of what we do. And at this point, Dr. Bloxham, you know, doesn't really have enough time on tissue to even apply to the IHS. So, but that doesn't mean, and I'm glad that you're calling, I tell people all the time, it doesn't mean that he's not good at what he does or he hasn't learned from somebody who's really good. And he's only going to get better as time progresses, as he has more time on tissue. So I'm really glad that you had a good a good result because he was pretty new in the game by the time he got to you. He was probably only about 2 years in.
Yep.
Yeah, I think he was around like 2 or 3 years in.
Yeah.
But I kind of went with the feeling that since he was trained with Dr. Feller, like he had a good staff, and then I thought like hair transplantation surgery is not just the doctor, but the team also plays a big role.
Absolutely,
So I went
and
with
basically the same team that Dr. Feller been working with. So the 70% of what you're dealing with had many years of experience aside from the doctor's hands.
Yes. Yeah. So I was like happier. I mean, I think it just changed my life like in the last 1 year because I was just like I just lost a lot of weight and I was like good at like doing things where I really struggle, like in terms of I was able to like organize my day much better. I think I've never like I would just take a shower and like not look at my hair, so I was that comfortable.
It's a great feeling, man. A good hair transplant. That's why that's another thing that bothers me because the industry has turned in such a bad direction. There's so many bad hair transplants out there, and there are so few that are getting the results that you are describing. And you're really fucking lucky, man, because when it's good, it is fucking life-changing.
Absolutely.
It's life-changing.
Yeah.
I mean, honestly, at work, I was like the guy, like, I mean, after I got the hair transplant, there were 3 other guys in the same floor that I work went and got a hair transplant. Not from the same doctor, though. They went probably like 2 different doctors, but they were impressed by the result that I got. And that kind of like motivated them to go and get a surgery done. So,
well, first of all, I'm really happy for you, and you're right. It is a long story, but I'm glad that you called, and I'm glad that you were able to get help from the Bald Truth, and that listen. Even though Dr. Feller's not doing surgery anymore, you went back, you felt comfortable, and it was fucking life changing. And I think that's incredible. I mean, do you have any questions for us now while you're on the line, or did you just want to tell your story?
Yeah, I have one question. So this is the last part. This is the interesting part.
Yeah.
So like 4 months ago, I guess, I was just reading all these side effects, and then there's like so much negativity on finasteride. So I was kind of like getting to a point where maybe I'm like doing something wrong. I have this amazing result. Maybe I should probably like slowly stop taking finasteride. And I think I just wanted to see what would happen. Like just if I stop taking the drug, and then I just like
famous last words.
I'm sorry?
He said famous last words.
Famous last words. I got the perfect result. I'm super happy. Let's see if I can fuck with it.
Because I've read so many negative things that are not currently happening to me.
I know, and I was so stupid, and I just stopped taking the drug like 4 months ago. And back in Feb, I noticed like my hair started falling out like crazy. But I think most of the hair around the transplants, it started thinning. And now I just felt like I've lost 20% of the hair around the transplants. So the question that I have for you guys is, I'm back on finasteride at least for like a month and a half, and I'm using Rogaine. Does it help at least get 10% or 50% of the lost hair, or is it not going to work?
Well, here's my question to you: were you on minoxidil or Rogaine prior to this shed?
No. Like 4 months. I was taking maybe finasteride like once a week or like twice a week.
All right, so you went through a complete all out panic and decided to throw everything at it at once, and I understand that. Look, I'm not a fan of minoxidil being used in conjunction with finasteride initially because you really don't know what's working for you at first, and sometimes you just kind of set your whole hair cycling balance off, and it can really, you can go into a greater telogen or longer lasting telogen, fluvium, or, but you're there. So at this point, all I can say, I have known guys who have stopped using the drug, who have lost ground, and then they they grew their hair back to where their baseline was before they stopped using it. I've also known guys who have stopped using the drug and they were not able to get back to that baseline, but they were able to improve and then continue to, keep their hair as they were when they were initially using it. So I want to say it's possible that you can get back to the baseline before you stop using the drug. But I think that this is a really interesting and cautionary tale for everyone out there who's been taking the drug for a long period of time with success and without side effects. Stay off the fucking internet, stay off the forums, and just keep doing what you're doing because you were doing something right, in your case, for over a decade.
Yeah.
And this is not, I hope you don't feel like I am, chastising you in any way. I just think this illustrates a really important point. Your story is not atypical. It's more common than I like to think, but I hear about this all the time. Yeah. It's kind of like, if you have like rosacea or cold sores or whatever it is, and they give you a list of triggers or what can trigger this, and someone says it's sunlight. You got to stay out of the sunlight. Everyone's going to get rosacea or cold sores if they're in the sunlight. Well, only a percentage of people that's a trigger for, but that's what's out there time after time after time that you read. So, people automatically think that it's going to be somehow related to them, even though they may be in the sun all day. They may be, they may be people who have to earn their living in the sun, and they've never had an issue. I guess my point is, I don't know if that's a great analogy, but I guess my point is that everybody is different. I've been on this drug for more than 2 decades. I don't know if I'm going to have some sort of bizarre form of cancer that could be eventually attributed to this drug. But currently, to my knowledge, I have no adverse side effects. And I've read them all, and I've heard it all. And you know what? I don't listen to what these motherfuckers say, because in my world, so far, it's been a positive thing. So I just, with that said, I just hope that, obviously you recognize that. You're probably not having any adverse side effects right now. And I do think that since you were such a good responder, I'm not a physician. I also don't have a crystal ball. But I do think it's possible that you could get back to baseline in 6 months.
Right.
You have gotten back on the medication, yes?
I'm sorry?
Have you returned back? And forgive me if you said this, I missed it. But did you get back on the medication yet?
You did.
Yes, I did. As soon as it's just amazing because I felt like I lost a lot of hair in a matter of 2 weeks. I haven't been taking the drug for like 4 months, but I felt like this significant thinning happened because I felt like my hair, I lost the density of the scalp within like a week or two. Or
it takes 2 weeks before your DHT gets to baseline, and then it takes it takes weeks or months for your hair follicles to be affected by that DHT. So some people could be off the drug for a month and get back on it and they're fine. Kind of,
I think maybe this was a coincidence where you're going into a telogen phase with some of your hair and just coincidence. So
knocked it out.
I agree with Spencer. I'm not a doctor, no crystal ball, but you've not been off of it long enough, I think, to where you would have zero chance of getting back to at least baseline or close to it.
I think he has a good chance.
Yeah. So, just stick with it and keep us updated. Let us know how it works out.
Yep, definitely. Because I know I also forgot to mention that I've been so stressed out in the last 4 months. So it could be a possibility that it could be telogen effluvium, but I just got back on the drug as soon as I noticed so it's been almost like a month and a half. So I'm just hoping that I'll be at least be able to bounce back.
Well, it's definitely an effluvium, and I would say that it's definitely because of the timing and the fact that that you got off the drug. There's no doubt in my mind. I mean, stress could be exacerbating it to some degree, but it's unlikely, and it's you've been on the medication for a decade. And it's the guys that there's a lot of guys who have contacted us and have said, I've been taking this for a long time. I'm not really sure if it's working. I'm kind of just maybe I'm a little worse since I started taking it 15 years ago. So I'm going to stop taking it. And then bingo, they're Norwood 6, within a year and a half.
Right.
And then they realize, oh, fuck, this was working.
Yeah,
So,
that's exactly what happened to me. I thought that maybe I was just like my hair loss just stabilized. Maybe the drug wasn't doing anything, and then I just got off it like for 4 months, and yeah, it was not a positive thing. So
if I had to sell a car to get my hands on this drug, if I couldn't afford it, if all hell broke loose, I'd be breaking into fucking pharmacies for this drug. Okay? That's how serious I am about it.
Right. I understand.
So it'd be drugstore cowboy for Propecia.
Yeah. I feel like we're all addicts for Propecia.
Yeah. So that's why I find it, I don't know, it's disturbing to me that there's so many people who they won't allow, or they can't seem to get past whatever issues they've had with the drug, just to allow other people to potentially benefit from it. And so many thousands, hundreds of thousands of men have benefited from this drug. And I want to make it clear, I am not being paid a dime by Merck Pharmaceuticals to say this. So anyone who claims that is not only stupid, because it would be illegal for them to allow me to promote them and promote the drug if they were actually paying me without it being disclosed on this broadcast. This is a fucking pharmaceutical company. So anyone who says that is it just really shows the level of nonsense that goes on the internet, because I hear this shit all the time. Mm-hmm. It works. It helps a lot of people. It changed my life. Again, will I come on the air one day and say, you know what? I'm one of the lucky few that was, diagnosed with breast cancer, male breast cancer, and I've been on this drug for 20 some odd years. That's a possibility. I don't know. But I was willing to take the risk, and so far, after 2 decades, I have no side effects that I'm aware of. Period. So listen, dude, we're going to take some more calls. I really appreciate your story. First of all, I'm glad you had a great hair transplant experience. I'm pretty confident, and I would say that most doctors would agree. We are not physicians, but based on your history, you should probably respond just as well as you did for the last 10 years. It's just going to take some time for your hair to cycle,
Yeah, I think I'm fine to wait and hoping for hoping things would get back to normal. But yeah, it was a pleasure talking to you and Joe. And I've been a big fan of this show for like such a long time, and finally I was able to talk to you guys. So yeah,
I'm glad you got through, and I wish you the best of luck. And please try to call us again. Let us know how you do. I'm pretty sure you're going to come back with some positive feedback or positive experience.
Absolutely.
All right, man.
Thank you, Spencer.
Take care. The phone number is 888-659-3727. Oh, lines are open. Everyone just hung up, unless I hung up on you guys. I'm sorry. It's very possible.
Oops. That's a good story. I like hearing that. It's encouraging until he gets to the point later on after the great result. Yeah, but then I started reading stuff about online about the side effects, and I thought, I'll try stopping for a while.
Well, and that's why I kind of put that analogy about rosacea or cold sores, which is herpes or whatever, and the different triggers that are out there. I have someone close to me that has dealt with rosacea, and this person, it came down to being extremely stressed when this person has the breakouts. However, they are hyper concerned about every food and this and the sun and all this stuff. And the reality is those were never this person's triggers. What tended to trigger this person eventually was an intense level of stress that they were putting themselves through, and that was being put on them. So, I mean, we go online, we read all this stuff, and we scare the shit out of ourselves. I can't even tell you how many times I thought I had testicular cancer when I was on this drug. Initially, and that was even before the internet was in its infancy. I was reading books.
We had the same issue. I just kept thinking someone sneaking in my house at night when I was asleep and kicking me in the nuts. I didn't go down the cancer route in my head. I was just like, who the fuck is doing this?
I was living with somebody at the time. I'm like, what the fuck are you doing to me at night?
Are you still mad I took all the blankets?
Yeah. Jesus Christ. And then I got bunk beds, and then I was fine.
Again? No. So there's another subject I want to talk about. Do we have any callers on hold?
We do, but guys, stay on hold for another second. We'll take your calls. Joe has something important to say.
Well, talking to patients recently, one of the things that I look for when I'm working with doctors or sometimes that they come to me to kind of help them with some ideas is trying to be innovative and I guess just consistent with follow-up of patients. And it sounds like a very simple thing, and it is, but people will be surprised about how tough this can be. And I was talking to, I've talked to a few patients recently where they all said something that really bothered me, only because these people were putting some blame on clinics that I don't work with, but I know of them, saying, yeah, since I left the clinic, I've really not heard, I got like an email or a phone call or something like that, but it's been, 5 months and I've not heard from the clinic. And I say that because, I'm concerned about it because I had some issues and, I didn't know where to go. And it really, it irritated me because, I think it's important that patients understand that when they're having a hair transplant surgery, every clinic should have a good post-surgical follow-up regimen to make sure their patients are happy and and progressing nicely. But if patients have chosen the clinic that they feel comfortable with having a procedure with, and then after the fact they run into situations where they're not sure about something, pick up the damn phone and call your clinic.
It seems like it would be so logical and such a, in my mind, that's my first fucking move.
Well, here's the thing. The problem is but a lot of people think that, especially in today's age, that people should lead them around by the hand. In other words, that they shouldn't have to be the one, hey, I paid this money and they should be contacting me. Yeah, that's true. But at the same time, if you're concerned about your own well-being, if you're concerned about your result, if you want to make sure that you get the best result possible, if you have a question about your result that isn't in the sheet that they gave you when you left, or it's not in the video that that you got on a thumb drive or whatever, pick up the damn phone.
Look,
how hard is that?
You can buy a $112,000 Range Rover. Don't ask. And as soon as you're out that fucking door, you would think, hey, let me send this guy a fucking Christmas card. Let me call this guy, see how everything's running.
A good dealership would do that.
Right.
And I've had that, but yeah.
Yeah.
But this isn't a case where you call up and say, hey, Range Rover is my fucking Christmas card.
Right. But I let's just say that, there were a couple of issues at one point, and it's kind of like, oh yeah, you go into the dealership and it's like, they're helpful, but there's no fucking pride of fucking service anymore in anything, and the same thing goes for a lot of these guys who are performing, and this is medicine, Yeah. For crying out loud. It's so easy to do follow-up, but you're right. Pick up the fucking phone.
In FSK in the chat group, he says sometimes it's the same generic answers that the clinic gives everyone, so you feel like, what's the point? That's a great point.
That is a good point.
But that's when you start asking them questions that most people don't ask them, like, and I won't speak about anyone's particular situation, but if you get, let me think of something. So,
you know what I'm going to do? I'm going to have to call the guys on the Bald Truth and ask.
Yeah, there you go.
Publicly.
I got to call the non-doctors.
Yeah.
And tell. This is what you say. I'm going to call the non-doctors on the Bald Truth, Joe and Spencer, and ask them on air why you aren't answering my questions.
And I guarantee you'll get all the response that you need.
Exactly. And they'll roll the red carpet out. No, but seriously, I can understand, like, if you're between 3 and 5 months and you email the clinic or you call the clinic and you say, hey, you know what, I'm concerned because I'm not getting growth. Well, a generic answer is necessary, because you're not supposed to, like, this is what I'd say. It's like, well, you're not supposed to really have any results yet. I mean, growth might begin.
And you put him on the crazy list, right?
Yeah, and I put them on the crazy list. Right. Exactly. But those are generic, basic answers that work, right? There is something to be said about spending more time to explain why this is the case and all that good stuff. But I'm talking about situations where there's a legitimate issue, and people are just too afraid to pick up the phone. The bottom line is, it's a two-way street. So if you got questions or if you got concerns, don't wait for the clinic to contact you. Pick up your damn phone, open your laptop or your phone or whatever, and engage, reach out to them yourself. It's your responsibility. You pay the money. You're the one that's got to live with the result, not them. So make sure that you get the answers that you need. If it seems like it's a generic answer, then go to a different clinic and ask them, hey, I was told this, this, and this. Is that an accurate answer? Or contact us here on the show, give us a call. But that's the thing. It's like, don't always wait for the clinic to contact you. Contact the clinic if you got questions or concerns. Rant off.
It was a good rant. And I tried to make an analogy with the Range Rover dealership, but I don't think it landed. But it was still a good rant.
It was a good, thank you. But
not that I would know about Range Rovers. Those are expensive cars.
Yeah, just
it's a friend. A friend told me about it. All right, guys, let's take a call. Eeny, meeny, miny, mo. Hey, you're on the air. Who's this, and where are you calling from?
Hey, guys, this is David from Texas. How y'all doing?
David, man, how are you?
Oh, David.
Good. I called y'all a few weeks ago. I had some questions about, like, topicals and things like that, if you remember. I was having the problem with, like, even Rogaine. So what I got to thinking was, especially since I've been listening to y'all a lot lately, is that obviously it would be better if I could go back to finasteride. And I was thinking, like, well, what if part of the reason, because I had been using topical finasteride, what if, like, something else that I'd been using had interfered in it, right? Maybe if I'm using topical finasteride and minoxidil, could it be possible that the minoxidil, that's something in that is, like, making it go systemic? And I wanted to know what y'all thought about that.
Well, I guess it's certainly possible that if you're using something like a topical minoxidil formulation that may have a vehicle that is, minoxidil already has a vehicle that helps the drug penetrate into your scalp. So if you're using topical minoxidil mixed with a topical finasteride, there's a greater chance that finasteride will affect you systemically. It's not a huge chance, but there's a greater chance, for sure. Okay. And that I would say that that's a really bad idea, in my view, to combine to combine two topicals like that, especially minoxidil and finasteride.
Yeah, I've been trying to start up with it again, just like taking small amounts. I wanted to know, about, like, the different kinds of, because I know that you guys have mentioned, like, a lot of different doctors are providing topical finasteride, but the truth is you don't see a lot on anybody's websites about it. Nobody really talks about it. Most doctors don't discuss it on their websites. So it's hard to know, like, if there's differences. And what I understand is that if you wanted to avoid for it going systemic, you want it to be liposomal. So I don't know if all the doctors are giving liposomal or not. So there's a part of me that thinks maybe some of these doctors think that like it's a nocebo effect, So, somebody who's had issues with the pill, maybe if we give them the cream that they, even though it goes systemic, they won't have the issues because they'll think it's better. But I'm asking because I've been using Hassan and Wong's formula, but I can't actually get any more of it. So if I find that it works for me, I won't actually be able to get a refill because they said they stopped giving it out to people outside of Canada. And so that's why I need to know. And also, I noticed it's like 2.5%. And when I go to the prescription, the website of the pharmacy that sends it out, they even say on their page, like, this means that you are going to absorb 25 milligrams per milliliter, which is a way higher dosage than. So I'm trying to see, like, what do you guys think? Like, why do you think that they're giving such a high percentage? Is it too high a percentage? What's the thought on that?
Well, I'll let Joe talk about it, but I'll give you my view. I mean, I do think that there is something to be said about your theory of the nocebo effect, that a lot of physicians out there who are putting or who are working with compounding pharmacies are like, well, you know what? They're not getting as much of the drug in their system in general. And, whatever is systemic, some of these guys could be suffering from some psychological or psychosomatic effects. And just by the very thought of putting something on their scalp topically with less absorption, they're probably not going to have these side effects. But if we do get some absorption, they're probably going to get better results.
Yeah, that's basically it. I was around when that original topical formulation was being worked with, and I don't remember the specific conversations, but I remember that being part of the idea, is that you don't get as much that goes systemic from a topical application. So it makes sense to add a little bit more to make it a little bit more concentration heavy, so that what does get through is going to be something that's going to be effective for you, right? So in other words, there's waste, right? I mean, it depends on how you apply it, and what formulation you're using, because there are a lot of different formulations for topical finasteride out there now. But because you can't get it from Canada any longer, there are topical formulations that are supposed to be really good. I don't have any personal experience with them. You're in Texas. There are plenty of compounding pharmacies that ship to Texas. You can contact go through the list of doctors on IHRS, or you can even contact any of the doctors I work with and see if they offer a topical formulation. Some doctors, I know of a couple that do this. Even if they're not in Texas, they can do what's it called? Like a electronic prescription service. What was that called? eScript.
eScript, yeah.
Something like that. Yeah. So they don't even have to be in the same state as you. I could be wrong about this because I don't live in the States right now, but that is something that might be available to you. So, do some research and look around and find someone.
Yeah, I will. The only problem is it's hard to be a good consumer because they're not advertising it. Like, there's not, like, if I go to Dr. Cooley's webpage, I don't think it says like, oh, this is what I provide for topical.
Yeah, you're not going to find that. You're going to have to pick up the phone and talk to these people and ask, do you know of any pharmacies? Look, here's the problem. You're going to run into not so much finding a topical formulation. You're going to run into problems finding doctors that will prescribe it for you if you're not even their patient. That's what you're going to run into. So,
and there are actually, I mean, even though there are hair loss or hair wellness brands out there who are working, they're prescribing generic finasteride and minoxidil. This is in a category that's different because it's being compounded. And it's something that really can't be necessarily sold electronically, online, openly, unless a physician can prescribe it themselves and tell you to go to this or get it from this compounding pharmacy. But like Joe said, you really are supposed to be their patient in some form or another. So it's a kind of fine line that some of these doctors, even though this could be very helpful for people, trust me, I've been approached, and the reality is, if I thought that it was something that could really be done and it was completely legal across the board, I would support one particular product or another, make sure that consumers had the chance to get it, and I'd make money from it too. You know, it works. But the reality is, when you're compounding drugs, you have to work within the legal guidelines. And if you're able to just get it online easily, then you're not dealing with what I would consider to be a legitimate situation. So you're not going to see it readily available on most people's websites, at least in the United States of America. There's different rules as far as what's being able to, people are able to put on websites in different parts of North America, like Canada. Like in Canada, you're not even supposed to put before and after images on your website. But you can put certain things about drugs on your website.
Okay, gotcha.
Yeah.
Yeah, it's interesting because I happened to have a dermatologist appointment today, and I asked my derm for it, and he was like familiar. Well, first of all, he didn't even recommend at first, having liposomes. I had to recommend it. Yeah, I had to say that. He would have just given me a normal one. And then when I said that, he said, "Oh yeah, that does help it, in theory." And so but when he tried to look it up, he couldn't actually even find it because it's been so long since he's prescribed it. So, my concern is making sure, that I have it from a reliable source that actually has, the right things in it to prevent it from going systemic. So I think it's safer, like y'all said, to go with, an actual transplant doctor rather than just any generic dermatologist, I guess.
I would say for sure. And I would also say that there's always going to be some systemic effect.
For sure.
It's just going to, it's just going to be what, how much is going to be systemic. And frankly,
yeah, there's the idea. Yeah.
Yeah. So, all right, man, listen, we really appreciate the call. We're going to take a couple of other calls, but yeah, I mean, stick to a known commodity, someone who is known to have integrity. I think, you mentioned Jerry Cooley, great guy, and a really, a credible person with a lot of integrity. And if you decide to become his patient in some form or another, whether it's, going down there, visiting him, I don't know if he would do something like this online or not. I guess there's a possibility. But, stick with, go ahead.
I also was wondering, about, on the subject of topicals, what do you guys think about people? I've heard about, even someone in the chat mentioned that someone in the chat said in Brazil, when they do PRP, they also inject finasteride. I've seen comments from people saying that, that they've been to places where they inject dutasteride along with their PRP. I mean, if people really believe that this doesn't go systemic, you would think that they would be doing this kind of thing and injecting or having us rub dutasteride into our scalps. Do you have any opinion on those kind of clinics that are doing those kinds of things, or have you heard about this? Or
yeah, I mean, there's something called what is that called when you mix different medications into an injection? Joe, it's called something. I can't remember what it's called.
No.
Why can't I think of this? Anyway, this has been around for a long time. So essentially,
Stacking?
No, not stacking. It's called something. It's done in cosmetic surgery, and it's done. So essentially, what these guys have done for a long time is they've combined different medications in their own formulation, and they inject it into people's scalps or into different parts of people's bodies, faces, whatever it is. Some did it for kind of medical liposculpture, and some people are doing it for hair loss. Why can't I remember what it's called? Anyway, this has been around for a long time. What do I think of it? Let's put it this way: back in 1987, I was sitting down with Dr. Norman Orenreich, and he offered to inject me with different anti-androgens into my scalp, and a lot of people were getting it done at the time. And I'm just like, there's no fucking way you're going to do that. I got to see some evidence. And so this, in theory and in practice, has been going on forever. So I forgot. Well, he was injecting progesterone and some other anti-androgens into people's scalps. Were they getting results? I've never met one who did. Now, would topical dutasteride being injected into the scalp or dutasteride would that work on the long term? I can't see how it's going to work in the long term if they're just getting one dose during PRP.
I see.
It makes no sense to me because it's out of your system.
Yeah.
Like you might as well piss it out. It's like one shot.
You might as well
like
put it. You might as well put it in shampoo.
Yeah, it'd be more effective in shampoo actually.
Yeah.
Compared to one injection. Yeah.
All right, man. Listen, wish you the best of luck. Keep calling. Let us know how things go. I'm definitely curious to see what route you take.
Yeah, we'll do. Thanks a lot, guys.
All right, take care.
Have a good night.
Bye bye.
All right, thanks for calling.
888-659-3727. Hey, man, you're on the air. Who's this, and where are you calling from?
Hey, how you doing? My name is Tony. I'm calling from North Carolina.
Tony from North Carolina. What's happening, man?
How you doing?
How you doing?
All right.
Joe, I want to say I saw one of your videos on PRP plus ACM that you did with Dr. Cooley. And luckily enough, I live about an hour away from him. And
nice.
I saw you had a follow-up video where you said you saw results. You saw a thickening of I guess even at your hairline where you part your hair.
In the separator between the transplant hair on top and then the native hair on the side. So that area, that no man's land, thickened up a bit, and then the bottom of my crown thickened a bit too.
How long did these results last for you?
You know, here's the thing. I'm not like treatments and small improvements in here and there. I don't obsess over them. I don't pay much attention to them because I know that no one else notices it. No one else gives a shit. So it's like, to me, like I had to look closely. I completely honest about this. I had to look closely. I mean, I looked in photos. I did compare some videos. There was an improvement, but is it something that anyone else would notice? Not really, not likely. So after I made that last video, the follow-up, I think it was 5 months. I looked at it like it would be in the back of my mind, just like, okay, is it still holding on? And I don't know when it stopped. I mean, it did. Like it's gotten, it's kind of thinned out a little bit, but even the amount of thinning that it's had, it doesn't really make a difference. I have to look closely, and it has to do with the length of my hair, and it has to do with how I style my hair. That's how I can tell the difference. And at this point, it's like what, 3 years since 3.5 years since I had that done. And I'm sure it probably thinned out maybe a year and a half afterwards. So
okay.
Yeah, I stopped the dick weights because yes, there was an improvement, but I'm sorry, it just came to my mind.
Did I hear that correctly?
Yes. Yeah.
Where the hell did that even come from?
Talking about, small improvements.
Yeah. Really small improvements.
Yeah.
But yeah. So,
let me tell you something. An extra inch down there, it means a lot. Go ahead. Sorry.
Hey, if you have an extra inch, you will know. Everyone else will know.
You will notice. Yeah. Maybe no one else will notice, but you're going to fucking notice.
Who?
So
anyway,
I'm saying Dr. Cooley for this PRP.
Yeah, and here's the thing about
Dude, by the way, I don't mean to cut you off, Joe. Are you speaking? Are you on a cell phone, dude? I mean, are you on a speakerphone on your cell?
I am. Do you need me to turn it off?
Yeah, if you could just speak into the mouthpiece, it'd be great.
No problem. Give me 1 second here.
Sure.
Okay.
Go ahead, Joe.
You there?
All right. Can you hear me a little better now?
A lot better.
Yeah, it's much better. Much better. Thank you. So, Dr. Cooley, the way that he administers his PRP, unless something's changed since I talked to him last about it, he doesn't believe in doing the multi injections per year route because he's seeing great results relatively with just one shot. There is the option for coming back for a second, like 6 or 8 months later, but he told me, he said, in my experience, it's really not necessary because it can last longer than a year. In fact, he showed me, there's actually an example on his website where a patient came in, had the PRP procedure. He shows the results after, I think this off the top of my head, I think it was after 1 year or 6 months showed the result, but then showed another result 4 years after. And while it did lose some of the coverage, it was still better than baseline. Like it was significantly better than baseline. And the guy had never touched finasteride, had never touched minoxidil, had only had one PR treatment, and it really influenced the long-term result 4 years later. So, you know, and this goes back to what we're talking about at the top of the show about the truth about PRP, and that there are differences in the different clinics that offer PRP, the different systems that they use to centrifuge, the different additives, the different application styles, so many different ways to do it. And that's why it's important to find a clinic that's got demonstrable results that can show you, oh yeah, sure, we got this, we got this. And you can't find the same results doing a Google or 10i, image search, that kind of thing.
Right.
So, yeah, he's a great source for this. He's one of the pioneers. I hate using that word, but it's true, of PRP for this issue. I mean, PRP has been around since the 70s for sports science, but Joe Greco in Florida, he's big in this. Dr. Cole in Atlanta, he's big on this. There are some really strong names behind this approach that have great options for you. So, but yeah, I mean, if you're an hour away from Dr. Cooley, I mean, good for you. It's a great resource to have. Lucky. Yeah, you should. Yeah, he's a great doctor. He's a great guy too.
And maybe, if you don't mind, I'll tell you a little bit about what I've done to counter my situation.
Sure.
So I've had 2 hair transplants to the front third of my scalp because that's really where things got thin. But before that, I'd been using topical minoxidil, 2% minoxidil mixed with retin-A since I was like 26. And I know that slowed things down, but right around where I got, in my late 30s, I began to notice significant thinning. So I went here in North Carolina. I went to Dr. Coher. He lives in Winston, Raleigh, Durham. Have you heard of him, Dr. Grant Coher?
Yes, I have.
I had 2 procedures with him, and I feel I had decent results. But the hair, and I started, because of you guys, I got to say, because of you guys, I started taking finasteride once every other day. I get the Pro Scar, and I cut it up into 5 pieces. And I think that's given me some decent slowdown, but I noticed some areas are still miniaturizing to the point where I said, let's see what PCP and ACM can do for me. So that's where I am right now.
Okay. Well, how long have you been taking finasteride?
A year and 2 months. That's when I found out about you.
So you've been on it long enough to know, that what your results going to be like. So that's a good launch point for adding something else. In this case, PRP, because a lot of times guys are like, well, I've been on finasteride or insert treatment here, minoxidil, whatever, for 3 months. I want to try something else. Like, no. Wait at least a year. Let it do what it's going to do. So that when you add something, any differences that you see are most likely due to the second treatment that you've added, not the original, right?
Right.
So good. Yeah, that's good. Sounds like you're doing it right. And your procedure, this doctor, did he do FUE? Was it strip? How's the procedures?
It was FUE all the way. I didn't.
Dude, we're losing you, dude.
You're losing you. Can't hear you.
Hello?
Yeah.
Yeah, I'm back.
Here you are.
Yeah, I did FUE all the way. There was no way I wanted to do the strip method. And the FUE was successful enough that I can cut my hair with a one guard on a clipper, and you can't tell. You can't tell where they extracted the donor area.
Well, good for you. I always love hearing that, regardless of where you. That's like, yeah, good.
It's
awesome.
Funny. I heard of Grant Coher for years, and he never actually applied to the IHS. I think he called me. I'm getting some feedback from your phone, dude. I think he called me once or contacted me once, or his office contacted me about something, but they never applied to the organization. But I haven't had, from what I can remember, a lot of complaints from his office, from his work. He's been around since the 90s.
He's been around a while.
Yeah.
The one thing that, and I'll say this, the one thing that disappointed me when I had my first hair transplant was, he did the incisions, but he let his assistants do the insertions, and I thought he was going to be more hands-on doing the insertions of the hairs himself.
Yeah, that is the way that it's done, and that has been done forever. There are very few doctors out there that actually place their own grafts, but they're there. They exist.
Okay.
But it's few and far between. Most of these guys learned to do it the old school way, even if they were doing pure follicular unit transplantation using microscopes, and they were doing it correctly. They made the slits or the recipient sites, and they let their technicians place those grafts.
Okay, so that's a standard practice.
Standard practice, yeah.
I didn't know that.
I don't necessarily love that practice, and I've said that since the beginning of my career, but that is standard practice, because you got to realize that you're dealing with usually a minimum, 2 people who are placing grafts, and they're placing on different parts of your scalp. They have their own technique. Yeah. Some of these girls are folding grafts or rushing. They're thinking about the fight that they had with their boyfriend, or they're dealing with a hangover, or who the fuck knows? You know what's going on?
That went through my mind.
They got a yeast infection, and they're uncomfortable. And that is the reality. I call it the hangover effect, and it's very real. Now, I'm not saying doctors don't have it, but when the more cooks in the kitchen, the way that it works is, the more difficult it is to have the perfect result. I've always believed that. Now, if you have a great staff, people have been working with you for a long time, usually it's going to be fine, but each person has their own particular style. And that's just the way that it is. And it's not uncommon for people to come back and say, one part of, the left side of my head looks a little better than the right side, or vice versa.
Now that you mention it, my left side did come out better. Now that you mention that.
There you go. Now that's not atypical. It's not something that I think that anyone should be, you should set the torches off and, and fucking, get this guy for.
Pitchforks.
Yeah, the pitchforks. This is the reality of this industry, and no one tells you this shit.
Right.
Except us.
Except for us.
Except for you guys. Now, I've been splitting my finasteride into 5 pieces with my pill splitter, my Proscar.
That's a pain in the ass.
They are, and they're not always exactly the same size. Can that affect your results if you get a little more on one dose, a little less on the other?
Not a doctor, but I would say that I do not
Absolutely.
believe.
No, just kidding.
I don't believe so. I would say, eventually you're getting that entire 5 milligram dosage.
Yeah.
And you're fine.
Yeah.
But cannot give medical advice. That's just my opinion as a layman and as an expert in this field. As an expert, I have no medical degree. It's all anecdotal.
I hear you. I got 2 more questions, and then I'll let you guys go, if that's okay with you.
I appreciate it, because I got to get the fuck out of here.
Okay. Have you guys heard of a drug that's in trial right now called Breezula?
Yes.
Joe.
It's supposed to be an anti-androgen, oral anti-androgen that you take that's passed some kind of trials, and they say that maybe in the next 2 years it could be approved.
This is based on a medication that was found to help people with alopecia areata, which is not DHT-based hair loss.
Ooh. Okay.
What you and I are experiencing is DHT-based. There is evidence that it can help on some level. I think I don't know what the formulation is. I am the first to admit I have not paid a lot of attention to this, simply because it's just one in another long list of treatments that I don't feel are directly beneficial for sufferers of male pattern hair loss. Alopecia areata, however, it can be a big deal, big deal.
Game changer. A game changer.
Yeah, absolute game changer.
I would say, Joe, while this is on my mind, you should cut this segment out and put something about Brazula on it and let the people who are looking this up find this truth.
Yes.
All right.
And Brizola, Trendsetter says not Brotsu. Yeah, two different things.
Yeah.
Next question.
So my last question is, saw this video by this company called Vitaging. They're saying that one of the major causes of male pattern baldness is prostaglandins, and they recommend taking stinging nettle root for it. They say DHT plays a part, but so does prostaglandin.
I wrote a book in 1998 called The Bald Truth. And in that book, I wrote an entire chapter on herbal and nutritional supplementation for lowering DHT. And in that book, I wrote about stinging nettle, talked about prostaglandins, talked about, saw palmetto and DHT, talked about Pygeum africanum and how it lowers DHT. And sadly, that chapter, because the book did so well and kind of changed things in this world for quite a long time, there were a lot of companies that ended up developing and promoting and selling products based on that initial chapter. I came out after the second edition was published, and I came out publicly to say, you know what, these herbs can cause adverse side effects, just like Alopecia. And at least from the anecdotal evidence, based on taking standardized extract, based on the right dosage that was supposed to lower DHT, including the right dosage of stinging nettle, people were not getting results. So I essentially told everybody that I'm not a fan of the herbal approach, and I would not promote stinging nettle for hair loss.
So finasteride is still the best game in town.
Sadly, 20 years later, finasteride is still the best game in town. And honestly, I would not have believed this if I had a glimpse of this future 20 years ago. I don't know if I would have continued doing what I'm doing. Or maybe I would have done it differently, because I truly believed it was going to be over in 5 years. I'm like, holy shit, this is the holy grail so far. And cloning is right around the corner. There's this dude in the Netherlands who's already doing it.
Right.
Yeah, exactly.
And I believe in the herbal shit. And I mean, God, I learned a lot. So I guess I am glad that I continued on. But the reality is, sadly, there's nothing. And all those guys who are talking about the gray market stuff and all the stuff on YouTube, and anybody could put any shit on YouTube, man.
Yeah, onion juice videos. I couldn't believe it.
Oh, dude. Everything. And luckily, the internet was not around when I was doing my initial research, because I had to, it was an effort to get the information that I did, to buy the snake oils that I did, to rub the cayenne pepper on my hair and my scalp, and hang upside down with gravity boots from a chin-up bar like I did. I had to seek that stuff out and really work to get that fucking bullshit information. Now anyone just presses a button. Say it again?
The penis weights, all that?
Oh, the penis weights too. Tried it all, dude. Tried it all. I figured, you know what? I'm trying to grow my hair back. I might as well do this simultaneously.
Might as well.
So, all right, dude. Listen, thank you for the call. I think you are very lucky that you have Dr. Cooley so nearby.
I'm going June 21st to consult with him. So
nice.
I have an appointment with him.
Well, listen, man, good luck.
Good for you.
I wish you the best of luck. I'm glad that your hair transplant experience went well, or at least fairly well. A lot of guys who call in do not have the experience that you had.
I feel fairly lucky, and I can call back later, after I talk to Dr. Cooley, and if I have the procedure, I can update you guys.
Call back anytime, man.
Yep. Please do.
If the lines are busy, you won't hear a busy signal. Basically, it just sends you into a queue, but that means we're busy. Just keep trying.
Yeah. Sure.
All right, man.
You guys take care.
All right, take care of yourself.
All right, thanks for calling.
Bye-bye.
And we can get out of here on time.
Maybe.
Oh, why?
Any other calls?
No, not right now. Don't say that. I could shut off the phones.
You could.
Oh, what's going on?
There's some guy that in the chat room that came into the chat room because he asked on one of my other videos or one of our past broadcasts in the comment section, when is this live? And I brought him over here to us. He says, well, because I want to call on the show. And
all right, call in, dude. Lines are open. We'll take your call. And then I got to eat, man.
I don't think he's going to call. Okay, I should probably know how many grafts I got before I call, correct? No. Anyone else on hold? Will he be able to get through?
You can get through.
Okay. 1-888-659-3727. Waiting for Parker in to call in.
That's a number on the screen.
Yes. And there's no call.
5.
Oh well.
4, 3, 2,
2,
1. All right. I'm calling it. It is 6:59 p.m. Oh, I guess he's called.
Right. We'll do it quickly.
Is this Parker?
Yes, it is. Thanks for taking my call, guys.
You got it, man.
You made it through, buddy. How are you?
Good. I've been following you guys' program for a while. Old YouTube videos, nothing recent though. So it's pretty crazy to get connected on my first attempt. Thanks for waiting for me.
Well, that's fine, man. I'm glad that you called in.
No worries. You got through. Good
Yeah.
for you.
You shut that kid up. I'm just kidding, dude.
Yeah, I'm sorry. I'll go outside. The fiance's almost home. I'll give you a quick recap of my story. About 3 years ago, I started noticing my hair loss when I was about 23, and I'm 30 now.
Okay.
My mom's friend had a medical spa where they do, injections, facelifts, all this stuff, and she praised this new machine that was coming out, the Artist, as you guys, I'm sure, are aware of. And she said I'd be part of a clinical trial. They're doing basically test runs before they launch it in their clinic.
What year was this?
This was about 3 years ago. So
all right.
I got the procedure done for about $5,000, so it was very cheap. As far as the procedure, it went really well. I don't believe they put enough grafts close together in the front, so I have a lot of spaced out, sparse hairs, and I just was wondering a few options if you guys have a minute.
Sure.
Yeah.
Yeah, so I was on the HIMSS program taking the finasteride, and I was a big proponent of it initially, but then I started getting pretty bad brain fog, so I heard you guys really recommend switching to the name brand. Is that something I should look into?
Well, that's a good question, and we don't really know. I mean, if you were really getting brain fog, and I believe you, I mean, it's possible that you're going to suffer from the same adverse side effect from the brand. And it's also possible that whatever fillers and whatever, else is in that particular molecular makeup of that generic finasteride could have been causing the side effect. So, I mean, if that's the only side effect that you had, then it's probably worth a try if you want to stay on it.
Okay.
And again, we're not giving you medical advice. We're not doctors, but I mean, logically, if you had no really severe adverse side effects, meaning sexual side effects or anything long lasting, and if you want to be on the drug, then that would be your next step.
Yeah, it's kind of like a decision right now. I'm on the fence. Either I buzz it all off or I stay on it for life. I can't keep using this topic powder though forever. It's becoming more and more, and
well, you may not have the opportunity to buzz it all off. You have to see what the scars look like from the Artist machine first.
Yeah, that was another question I had from you guys because I wasn't sure if I'd actually have scars. I've never really, seen the back of my head since.
Well, I mean, back in, you said it was 3 years ago?
Yeah.
Do you know what size punch they were using?
No, sorry.
No,
I
it's
know
okay.
it was the most advanced Artist that they had at the time, though.
Okay. Well, just know that most practitioners will, at least according to some of our undercover tech, will set up the machine prior to the patient sitting down. And so the machine, in many cases, while, this has nothing to do with the manufacturer and this has nothing to do with the artist brand. It's just the way that these technicians are taught to use it or teach each other to use it. They're usually going to go with a bigger punch to make it easier to get a intact follicular unit. So I'm assuming that you probably have relatively visible scarring if you shave your head. And that's also going to depend on your skin color, if you go into sun a lot. So, what you can do is you can cut your hair short, you can comb through it, you can take a video camera behind, the back of your head. You could ask your fiance to take a look, and you'll be able to see if there's visible scarring.
Okay. Well, I appreciate that. I just feel like I kind of got botched, and I'm not sure if another transplant's worth it, maybe to fill in the areas they initially did, or if I should just stick with it. I made it work for what I have now, but I'm just feel like I'm running out of options at this point.
Well, does the work itself look natural? I mean, is it something that stands out as being unnatural looking, or can you get away with people not noticing that you've?
Yeah, I can get away with it. The hairline looks good. It's just if you were to rub your fingers through it in the front, you could see they're pretty spaced out. But the way I comb and everything, it looks fine, I guess.
This is a med spa that your mother works at?
It was her good friend, and it was the new machine they were getting. So yes, it was in Newport Beach, and I was one of about a dozen patients they were doing a trial run on.
Fucking women in Newport Beach, man, they will do anything. They are so into plastic surgery, it's unbelievable.
Oh, I know. I was against it initially for sure, and she kind of pushed me into it. I should have been my own man on the decision, though.
Oh, that's interesting that you say that. So you weren't that concerned about your hair loss. It was more your mom.
I was definitely concerned. She thought she was helping me out, but neither of us did our research on it. Let's just put it that way.
Well, listen, you can't blame her. I mean, that's what mothers do. And especially if she has somebody and someone's talking about the latest and greatest and this new technology, it's like fucking science fiction. And I'm going to give full disclosure. Most people who know this program know that I consulted for restoration robotics for about 2 years. I I know that the suggestions that I made helped to improve the size of the punches. They are now currently, they made a smaller footprint device. In general, I think they've made some really vast improvements. However, I would say that a lot of the people that ended up getting their machines, even the improved devices, did not really take the time to learn this craft. And in order to utilize that machine well, you really need to know what the fuck you're doing. Not just how to run the machine, but you need to understand every nuance of this surgery, because that machine performs surgery, or helps perform surgery in a very specific manner. And it has its limitations. And if the operator doesn't understand, and the operator should be a doctor, doesn't understand the machine's limitations and understand the different nuances of a person's scalp, hair characteristics, the fact that tissue from 1 square centimeter to another could be different on a human being and could react differently to different punches and may not react as well. You may not be able to get the same type of robust graft out just, a couple of centimeters away. It's got to be used by someone who knows what the fuck they're doing. Now, when you had the surgery done, was it performed by a physician or by a technician or by the spa owner?
Yeah, there was groups from, the actual artists. There was people from the artist company, and then there was people there that worked at the actual clinic. So I believe it was a few technicians along with a physician.
And basically they were showing the spa how to use the machine on you. You were the guinea pig.
I believe so. Yeah.
Yeah. Yeah.
Yeah.
Well, look,
so
I think that if you can walk away and say, well, at least it looks natural, then you might want to consider just, not addressing it any further, because if it looks natural, then you win.
Yes.
And I mean, if it's thin, then count your blessings. That's what I think that you should really have as a takeaway from this, because so many people.
And tell your mother I want her to call the show.
Huh?
I said, tell his
What?
mother I want her to call the show.
Yeah, I'm sure she could be talking for hours with you guys.
Yeah, I want to talk to her. This is a lesson. This is a lesson learned.
Yeah, here you go.
It is a lesson learned, and but I want to reiterate that as long as it looks natural, like if you honestly think that it looks natural, then there's a strong. Well, I don't think that you should really consider having any more work done. Now, if it's bugging the hell out of you, and you feel like you absolutely have to do something, then take some time and do the proper research. Like find doctors that are consistent. Find out what looks natural. Like look at, you can have a thin hair transplant and it still look 100% natural. It just looks thin. And there's nothing wrong with that. So unless you're after some sort of ideal result, then you should maybe consider putting the brakes on this.
Okay, I appreciate your input.
But yeah, I would say that if you really are considering buzzing your head, now would that have been a consideration before you had the surgery?
No, I only noticed I looked pretty good once they buzzed it right before the surgery.
Oh, shit, that's when you should have told them to stop.
Yeah, I know, right? I was in the lobby and I was like, hey, this ain't too bad, but I don't know. I just saw a bald guy walk by right now, actually, and I thought to myself, I don't want to look like that, so I think my mind's made up.
Well, if your mind is made up, I get it, but do not rush into anything. You can contact us, do your research, watch the broadcast, have your fiance check out your donor, and, put a comb through it very slowly. Let's see if she can see any of the punctate wounds.
Okay.
And if she can, then the likelihood of you being able to shave your head completely is probably off the table.
Okay. And then from there, maybe I should look into switching to brand name Propecia to see if I get better results in terms of.
If you want to stay on Propecia or on finasteride, I would say that's your next option.
Yeah.
Okay.
And again,
Okay.
I have to
Thank you
keep
guys so
saying
much
it.
for your input.
Not a doctor, not a doctor, not a doctor.
I'll try to call back in one of these days with more info. I kind of rushed this call. I really wanted to be prepared. I've been listening to you guys for a while now, and I just want to say thanks for everything you guys do. There's a lot of younger guys out there that they have nowhere to go unless their dad is dealing with the same thing, and then they just tell them kind of man up. And it's like that's not always the option for everyone. They want to.
Yeah.
You know,
you can't just say that anymore.
And Sally, most people's dads are idiots. Yeah. Just saying. So
that's true. Yeah.
All right, man.
Thanks for keeping the line open for me. Have a good night.
You got it, man. Take care.
All right.
Good luck.
Thanks for calling.
Bye-bye. You want to give out the websites, Joe?
Yes. I keep forgetting to do this at the beginning of the show, top of the show. But
well, apparently it's my job to remind you, so let's put the blame on me. I'm sorry.
Oh, well, another job, because your first job is to be on time. Ooh. Oh.
I'm not going to laugh at that.
All right. So, yeah, the websites, the people that support our message that say, you know what, we like those guys and what they're saying. Let's share in that message, starting up with hair loss experiences, just hairlossexperiences.com. Great resource run by a great guy who's also a repair patient and helps repair patients behind the scenes. Good on him. Hairlossexperiences.com has got lots of great doctors sharing their results and lots of patients sharing their experiences. That's hairlossexperiences.com. Next up, we got bellycapelli.formfree.it. It's a long, funny sounding name, but it's a great website. Another great guy, former repair patient, very old friend of mine that runs this website. Again, lots of doctors sharing their results. Lots of patients sharing their experiences. Check them out. That's bellycapelli.formfree.it. And finally, we've got the French Hair Loss and Hair Restoration Forum. That's international-hairlossforum.com. Again, you got clinic sharing, you got patients sharing, lots of information, and they believe in our message and allow us to stream through their website. That's international-hairlossforum.com.
And, for all the physicians out there that are listening to the broadcast, whether it's through our websites or on iTunes or iHeartRadio, wherever you listen to this broadcast, there's a meeting that starts June the 6th to the 8th in Manchester, England. It is the FUE Europe 8th Annual Congress or Conference. And I have to say that, I'm very excited and pleased to be a part of this. The IHRS is working with FUE Europe to really ensure that this is going to sound so fucking obnoxious, so I'm not going to say it. To put together a scientific conference, a meeting on hair restoration surgery or hair transplant surgery, FUE in particular, that is obviously a place where physicians can learn, share ideas, and exchange ideas, and all that nice stuff, all that happy horse shit. But this is the first conference of its kind that's actually going to be patient-centric. And that is the key component that I believe that has always been missing from this industry. It's sad because it should be all about the patients. A physician's first job is to put the patient first. Patients before profits. Patients before politics. Yeah, it's great to have some SEO guy come in and show you how to fucking, improve your website rankings. But what's even more valuable to these guys is to show you how to treat fucking patients. Because if you have happy patients, you really have to worry a lot less about being seen on the first page of Google. Believe me, trust me, that's the truth. Because
really is.
Word of mouth is everything, especially in this online world now. You could be invisible on the internet, practically. I mean, you need to be connected to certain reliable resources. But if you have happy patient after happy patient going out there and trumpeting the fact that they had a great procedure by you on different websites and, all over social media, you fucking win.
Yeah.
Or you could be the guy that pays a CEO and a marketing firm and all this bullshit to get out there and have a great Instagram following and all this fucking happy horseshit nonsense. And then behind the scenes, you're battling to get the negative shit offline about you.
Happy horseshit. My dad used to say that. I love that one.
Yeah.
What's interesting about this is you struck on something that I've actually been thinking about this for a bit. I know doctors, I know clinics that are spending $30,000 to $50,000 a month on local SEO AdWords for their market.
Idiots.
And I work with clinics that are only dealing with, third-party validation and, sharing, using the tools at their disposal to explain why they should be considered versus a guy down the street. And they're booked for 4 or 5 months. And you don't find, like, you do a search on, they don't pop up in the paid searches. They don't pop up on the top of organic searches.
Because a lot of these idiots have idiots, marketing people, telling them what to do and how to do it. And the only way these marketing people remain relevant and get paid is to say, hey, wait a second, I don't see any ROI from this. Let's move the money over here. And what they do, in order to maintain, they keep moving shit around. Dropping stuff, moving stuff, making believe they're busy. I promise you guys, they wouldn't be working for you if they knew if they knew how to do this themselves. They'd be working for themselves. Period. They market whatever they can market. They wouldn't be marketing hair transplants. People don't seem to understand that.
There's so much energy expended and money wasted in trying to stay on top of that game, and it just blows my mind, the money and energy being wasted to, frankly, for a lot of these doctors, just to see their name when they do a general search. They want to see their name, they want to see their face, and a lot of it's ego. I mean, it's obvious, but just so much of their resources are being wasted when all they got to do is follow a simple formula. First, do good work. I mean, that goes without saying, but follow a simple formula. Stop trying to rat race the other guys. Do it your own way. Do it the right way, and the business will come. The word of mouth way of getting business is still by far the single most powerful way to grow your business, to have bookings for a few months out. Not this whack-a-mole of trying to master SEO or master online marketing. It's horseshit.
It's not even strong third-party validation that you can show in your practice, like Joe Tillman used to do, to let people know, what you're about, and do good work. Save all your money. And I promise you, you won't be aggravated. It'll work. I had a guy, and we're going to go in a second. This is just for the doctors out there. He's retiring soon. And when we were speaking, now his practice was acquired, and he was saying how he's, going to make sure that the doctors that, that he trained that's going to be with his plastic surgery practice, whatever, is they're going to stay on with the IHS and all this stuff. And, maybe I'll have them give you a call so that you can tell them exactly what's going on and so they understand it. And I really appreciate it. This guy's been with me for 20 years. And I said, look, Doc, that's great. But the bottom line is none of these guys are going to be able to compete soon unless they kind of work in this arena and understand what truly works. Right now, it's every gorilla for himself out there. That's the way it works. So it's turnkey guy after turnkey guy after turnkey guy, and you guys are going to be spending so much more money, this guy as well, and this big plastic surgery practice, as opposed to just being a part of what we do, paying relatively small dues, keeping your head down like you did, and doing your work. He actually said to me that he really appreciated our relationship over the last 20 years, and that the IHS and being associated with the Bald Truth really helped his practice. Those were his exact words. We have no online consultations. We don't sell anything. There's no star system. Our forum doesn't allow people to say thumbs up or thumbs down, or this guy sucks, or this guy's great. We get shit for, quote unquote, censoring our forum. We're moderating it to protect you guys.
Yeah.
That's what these patients or these forum rats, that's a new one, forum rats.
I like that, forum rats.
Yeah. Don't fully understand. So here's the reality. I don't know why I got on this topic, but just do good work. That's it. It's not that hard. You have to step back from everything you're seeing and all the panic and the ads that you're seeing in your Facebook feed saying, I keep getting these ads sent to me from Neograft and these other companies that are promoting to doctors saying, and actually we should put them on the air, easy revenue stream, make this much money, without doing anything, do this, do that. Forget about that. Let these guys go in that direction. In time, if you just keep doing what you're doing and doing it right, you will be the last man standing. That's what I'm trying to get out there. Ken Anderson posted something that was really powerful on our industry Facebook group about training and the lack of training and all the shit that's going on in the field. I'm noticing that the guys are starting to have the courage to come out publicly now. And he actually stated publicly that he was told by some politicians in the ISHRS that if he moves in this direction, it will be frowned upon. So it's frowned upon to actually educate doctors on how to do this right because there's no other system out there that's doing it? That's fucking bullshit. Anyway, good way to end the show.
Yeah, it is.
My website, thebaldtruth.com, have not updated it since the Civil War, but you will see an update this week. So that's
this week.
Yeah, so that's going to change. Also, our message forum, baldtruthtalk.com. My motto, my mantra, stay off the forums. But if you want to interact with other hair loss sufferers, it's a good place to get a good solid base of information But also understand that a lot of the information is coming from anonymous users, like any other forum. I'm the only idiot in town that tells you to stay off the forums when I have a message forum. But, just use them wisely. Take everything with a grain of salt. Understand, and this is also important. If you're considering surgical hair restoration, check out iahrs.org. Again, our forum is baldtruthtalk.com, and the hair transplant organization, consumer organization, is iahrs.org. But just because someone is part of the IHRS, just because they have enough time on tissue, just because they have the right staff, just because they have, had the most consistent results compared to all of the rest in this industry, does not mean you're going to get a great result. There's no guarantees. And things change within practices. You have to be on top of it yourself. We create a safe place to start to do your research, but do your research. Don't be lazy and just say, oh, I see this guy's part of the IHRS and I see some good results on a forum. I'm going to sign up with him. That's not good enough. That's your starting point. IHRS, check out the results, go visit them, see their patients. You got to do the work, man.
That's right.
All right, guys, that's it. Whoever's on hold, sorry, we're not taking any more calls. So I hope you have a good night. Until next time, AmericanHairLoss.org, by the way, is the American Hair Loss Association. Be strong. God bless. And thank you so much for listening.
Sir, one more outburst, I will strangle you with my microphone wire. You understand me?
You're a smart motherfucker. That's right.
That's it. Got to end it like that.
No music.
No music. Cannot do it at this point. All right, guys. Have a good night.
Good night.